Hello, everybody. I'm Michelle Cacavano, for those of you I don't know. Welcome to our health. That's as loud as it goes? Okay.
J-Lo does that.
Yes. Wow, J-Lo, okay. I don't have her outfits though. So welcome to our health discussion tonight, health professions discussion. Just two things we want to tell you. If you could please turn off your cell phones. Okay? And since we're being filmed, and if you could just hold off on your questions till the end. So what we're going to do is we're going to each introduce ourselves, tell you our name, our profession, and our titles. And then we have a series of questions that we're going to ask the panel, and hopefully we'll cover a lot of things that will interest you. So I'll go first since I have the microphone. So I'm Michelle Cacavano. My title is doctor, and my profession is nurse practitioner.
My name is Frida Feldman. I'm sure you recognize me, some of you, and others don't, which is fine. I am a registered nurse, and I worked in a wide variety of situations in nursing.
My name is Joan Mandy.
You have to hold it straight, Joe.
Point it towards you.
Joan Mandy.
No.
The other way.
The other way.
Like you. Like a lollipop.
Like this. My name is Joan Mandy. I'm a registered nurse, and I have degrees, a bachelor's and a master's in health education and health services. And I worked in a hospital, but my last how many years was as a school nurse teacher in the Marlborough School District.
My name is Flo Jordan, RN. I won't give you the rest until later. The title is doctor. I think we're going to be talking about the varied roles and experiences that we had in the past. I just retired 2.5 years ago from nursing, so it's been a very long and sort of glorious profession. I'll get into the parts I don't so glorious. Okay, there you go.
I'm Dr. June Feiner, MD, MPH, and I have worked in a variety of primary care roles, and that will all come up later.
Okay, so for our first question, we're going to go around the panel. And the first question is, when and why did you decide to go into the health field? So for me, a number of my family members, my sister and my aunt, each respectively had rheumatic heart disease and congenital heart disease, and that instilled in me a lifelong interest and fascination with cardiology, and that's how I wound up doing that.
My situation was about as different from that as it could be. I went into nursing at the age of 35 because of financial needs, and since my husband had gotten injured at a fire, he was a New York City fireman, and one of us had to go out and get money. I became a registered nurse.
I worked, can you hear me now?
So it's why did you go into the health field?
I know.
Yeah.
I worked as a nurse's aide when I was in high school, and I really didn't think I wanted to be a nurse, but after I worked there, I realized that I could manage it, and so that's what really, I went to a 3-year nursing program, but then further, I changed my mind and gone into teaching.
perfectly honest, I always wanted to be a nurse, but I never had any experience in nursing. I was not a candy striper. I didn't really have anybody in my family that was sick that I would have to care for. I wasn't really a Cherry Ames, favorite book of mine. It was just something I always wanted to do. I'm not sure where that came from, but thank goodness. I mean, I went into nursing, that's where I spent the last 50 or 60 years.
I was born into a family with a father who was a doctor, and I think 3 uncles on one side of the family and 2 on the other were also doctors. And apparently as a small child, I was allowed to sit in his office and watch him. I was about 4 years old, I was allowed to go and watch. So I was always into it. And then later on, we lived in a house where his office was attached. And there was a dispensary at that time that was permitted, and my sister and I, we would wash out the medicine bottles and fill them, and we would count out the pills and stick the labels on the bottles. So it was very much a part of my childhood. And my father also had an assistant who had lunch with us, and they would be talking medical talk all the time. And then I was myself ill and in a hospital for some months, and really adored the doctors. So there were many influences. One was being sick myself, and one was living in a family with a doctor and listening to all their experiences.
So the second question kind of blends into this first question, which is what was the greatest influence in your making the decision to go into the field that you went into? And for me, I was in college and I was trying to pay for school. And I got a job as an EKG technician, and I was bored to death, so I was teaching myself how to read them, because it was a very interesting job. But I used to go into the coronary care unit and take everybody's cardiograms every day, because in those days, everybody got a cardiogram every day. It doesn't happen anymore. And there was a head nurse there, her name was Judy, and I was so impressed with her knowledge, how she was with the patients. And one day she actually had a conversation with me and said, "Did you ever think about going into nursing?" And that's how it began for me.
Well, even as a young person, I was always curious about everything in the world around me. So when I went into nursing school, I was the oldest student in the class, and I sat up front. And I asked all the questions that the young women didn't ask. And afterwards they would come to me and say, "I'm so glad you asked that question." So I say, "Why didn't you ask it?" And they say, "No, because you always ask them."
I think I made my decision as a nurse's aide, and then I just went into the nursing school where I worked at St. Francis in Poughkeepsie. And from there, it was nursing. I mean, I went there for 3 years, and then I became a nurse and stayed there, and I was a head nurse, and then I got into education. So that's a different story.
As I mentioned, there wasn't really any experiences in my past that just, made me go into nursing, except the fact that I had a desire to do that without any, really any background. But once I got into school, that's where it kind of all came together. And once I started my education and working with patients and the rest of the healthcare team, I realized that I had made the right decision.
Well, I had already talked about the influences, and really by the time I was about 11, when somebody said, "What do you want to do when you grow up?" I said, "I'll be a doctor or a nurse or a dancer," because I really like dancing also, and I thought nursing was lovely too. And then later on, my parents actually opposed the idea of me going to medical school. They thought it was too long and arduous a course because, I'd been ill. And I think partly because they opposed it, I decided I wanted to do it. So I actually was admitted to the medical school where my father had taken his training. So it was kind of nice. I was the second generation.
Now, excuse me, I just wanted to add one thing. It was either be a nurse or a violinist. And when my brother used to go screaming down the road when I got my violin out, I decided that really wasn't the way to go.
The next thing that we're gonna talk about is our education, and the public is so confused about the education of nurses, especially because it keeps changing. So, as far as my education, I started out in a 2-year program because I wanted to work right away, and that was the easiest way to do that. And then I got a bachelor's, and then I got a master's so I could be a nurse practitioner. And then I wanted to go into education, so I went back and got a doctorate in nursing practice. Actually, I was part of the first group in the first DNP program at Stony Brook. We were the first class. We were the experiment. What they found out in the experiment was 2 years is not enough.
Actually, 20 years is not enough. But I found that being an older person, I felt on the same level as a lot of the young doctors and interns when I worked in the big hospital. And I found that I did not have to say, yes, sir, aren't you wonderful? Yes, sir, I'll go get this, I'll go get that. Oh, certainly, sir, here's your coffee. I would say, why did you do that? I'm curious. What was the reason? And I drove them nuts.
Well, I worked at the hospital, and I was a head nurse in medical and surgical floor, and then I was married, and I had quite a large family. Anyhow, I worked evenings in labor and delivery, and then I decided, or a friend of mine decided she was going to take courses to become a nurse teacher, so we went back, and then I got my master's and my bachelor's and my master's in health education and health teaching. So eventually I became a school nurse teacher, and that's how I decided that.
When I first started out, I went to a 3-year diploma school. There were not, in our day, there weren't many 4-year programs, BSN programs, to be perfectly honest. When I started working after I graduated, I was very happy, 3-year diploma school graduate, working on units with my patients. But then a lot of my colleagues were talking about, if you want to get ahead, maybe we should start thinking about furthering our education. I kind of resisted for like 9 years. That was a long time. Because what they wanted you to do is a lot of the bachelor programs at that time almost didn't recognize a diploma school graduate. They didn't think that was education. Although we passed the same licensing exam as everybody else, even if they graduated from a 4-year program, we all took the same exam. So I kind of fought tooth and nail about going back, because that meant that I had to start all over again, basically. But after 9 years, I realized, if you wanted to get ahead, and especially in healthcare, knowledge was constantly changing. You had to keep up. I had to go back to school. So I started a bachelor's program, and I ended up with a BA in psychobiology at the time, and then I went to go into a master's program in nursing, because once you had your bachelor's, you could go into a master's program in nursing. By the time I got through the bachelor's program, they had changed the criteria for the master's in nursing, and they only accepted BSN students, BSN graduates into the master's program. So then I had to go back to school and make up some of those courses that I had missed when I was in the BA program. And that's why it took me like 20 years to finish. But then once I started, I did not stop. Once I started with the BSN program, I went on and I got because I was afraid that if I stopped, I wouldn't go back, basically. So then I got my master's in nursing education. Right after that, I went right into the PhD program. Now that took me about 10 years, because I stopped for about 3 or 4 years because I had gotten a new position in administration, and I just couldn't devote all my time to the administrative position, knowing that I had school that I had to worry about. And once I got that settled, I went back and I finished my doctorate. I also got a postmaster's as a nurse practitioner.
Flo, before you go on, I just want to ask you a question about diploma school nursing.
What?
What I found was that even though the BSN programs didn't respect it very much, the nurses who worked alongside the people with the diploma knew that those were the people that were the most experienced at the bedside. So it actually, I thought that you came better prepared to the bedside than 2-year or 4-year graduates. That was my experience.
Yeah, we did, because all of our training in those days were out on the units. And, you know, our schooling was almost year-round. I mean, I think I only had 4 weeks each year that I wasn't working or in school. I remember working nights 11 to 7, and I was the only, as a student, and it was just me and an orderly for a men's surgical ward of about 30 patients. So you either learned or, so you learned.
My training was fairly traditional. I went to the medical school in England, and there were 12 hospitals in the City of London, all of which were under the umbrella of the University of London. So I went to the Middlesex Medical School, Middlesex Hospital Medical School. I did it was a 6-year course basically, and then I did a surgical internship of 6 months and a medical internship of 6 months, which is what was the rule. And then, not being at all sure what I wanted to do, I decided I would come to the States and visit my aunt and uncle who lived in Chicago and take a job there for a little bit and look around and then go home again. So in the end, I took a rotating internship at Michael Reese Hospital in Chicago, met somebody, stayed on. I did a residency in internal medicine, and then after that, I did a whole bunch of work there with the whole civil rights thing, and then I went back to school. I came to New York in '67 to the Columbia School of Public Health, so I ended up with an MPH also.
You may be seeing a theme here where we all skip around and do different things. So I'm going to ask the entire panel what kinds of areas they worked in nursing. For me, I worked in a medical intensive care unit right out of nursing school, which I would definitely not recommend. And then from there, they were opening up a brand new non-invasive cardiology lab, so I applied for that after working about a year in the medical intensive care unit, and I wanted that job really bad. And there was a brand new cardiologist who was starting the department, and he interviewed me 3 times. And I said, please make up your mind already. And we're still friends to this day. We worked together for 7 years, and he got me started in research. After that, I went into an administrative position of the ICUs, a telemetry unit, a ventilator step-down unit, and 2 other units. And I didn't like that job because I wasn't near the patients anymore. It was all administrative, so I didn't really care for that. I went into case management after that for a little while, just for cardiac patients, and I liked that. And then I got my first nurse practitioner position, and that's where I worked in. I got to establish a heart failure program at Stony Brook Medical Center, and it was their first one, so I really liked that. And after I got my doctorate, I decided I wanted to educate nurses, so I started teaching. And that's where I spent the last 10 years. In fact, I just retired in December from Mount St. Mary.
I did a lot of what you did, wandered all over the place. I worked in every unit in the big hospital because I liked learning. I worked in the tuberculosis pavilion for a while. It was a closed pavilion, and you had to suit up like they do now for COVID. And it was a very difficult place to work because people did not want to go there to work. I worked at another time in an equally sad and difficult place. I worked with a very wonderful dear friend of mine who was another nurse with babies born with anomalies that were far beyond what I want to discuss tonight. And my friend would sit there and coo and sing and feed the babies, creatures, with such compassion and so much humanity that it made me understand what nursing really was. And then, from there, I went into the burn unit, which was like walking into Hades. You had to torment people to make them better. It was I wrote a lot about my experiences because I did not ever want to forget them. And that was one of the hardest places to go into. So I learned a lot about life, and I learned a lot about people. It was a good thing. And then after that, I worked for Planned Parenthood, which was equally wonderful. I felt that was a very good thing to do. And I met a lot of really fine people that came in. The women that came to us really needed us, and we were really glad to help them. And we did everything we could to help them in any direction they wanted to go. Nobody was ever told what to do, but we were really good listeners. And then I worked in a small hospital on the edge of a field of stoop workers, Mexican young people, old people, Mexican people, in a very old little hospital. And they would come in off the field with cuts and bee stings and stuff. And we took every one of them that came through the emergency room. And many times we did not put it on paper. They needed us so badly. Again, the sense of compassion became a very large issue for me. And I was always writing about what I saw. And then I worked as a visiting nurse out of Fort Myers. I lived on Captiva Island for about a year or two. And the people on Captiva were the ultimately wealthy of the wealthy. And then I would go into Fort Myers, into houses which were poverty houses. And the juxtaposition of the wealthy and the poverty really was very difficult. But I loved what I did. I loved speaking to people. I loved helping people. I loved listening to people. And actually, I was really a pretty good nurse.
Well, I worked in a high school, and I ran the health office, and I taught health classes every day, and the health classes, everyone has to take a health class in order to graduate. So it meant everyone in the school didn't have a choice, they had to have a health class. And I would see maybe 60 students would come to the health office in a day. They'd pull me out of the class to come down and help whatever their problem was. There were sport injuries, believe me, a lot of different things. And then I'd go back to the health class, and so this was a very, very demanding. They didn't have enough health teachers. They had one other one than I was. He was just a health teacher. When I had to run the office, I had children in wheelchairs that I had to get on the elevators to go to the classes, and there were constant gym injuries, and I'd leave my health class and have to go treat the injury and then go back to the health class. It sounds dramatic. This is what happened when I was at the high school. And then, well, I went to the elementary school after a point, but I'll tell you about that in a minute.
Chapter 2.
Right.
Well, a lot of my experiences were varied. Of course, I started in med-surg when I first got out of training. I worked in various intensive care units, coronary care, medical ICU, surgical ICU. I was working in the education department at the hospital. I was the director of that. I worked in, there's so many I almost forgot what they were. I worked in home care. That was interesting. When I transferred from the hospital setting to the academic setting, of course I was faculty, and I was chair of the nursing department for a number of years before I retired from that. I think one of the positions or experiences I had that were really, that I really loved and enjoyed was I worked as a volunteer nurse practitioner at a Rotary Care unit on Long Island, where people would come if they had no insurance or they were immigrants, and we never asked for money, we never asked for cards. They came from all over for care, and we had a relationship with the hospital that if I needed to have blood work done on my patient, I could send them over to the hospital. If they needed an x-ray, they could go to the hospital. If they needed some kind of specialist, a gastroenterologist or something like that, we could refer them to one of the guys or gals from the hospital. So I thought that was one of my most satisfying, not that the others weren't, but that was one of my most satisfying positions that I had. I did that for a number of years, and it was voluntary, and everybody that worked there was a volunteer. You know, we had a pharmacy on site, doctors, nurse practitioners, nurses. I thought that was a great experience, and of course I worked as a faculty person for the last 20 years of my career.
I also had a variety of different kinds of jobs. After I finished my residency in Chicago, that was the time I was most involved with the civil rights movement, and that's all on the table in the lobby, so I won't even talk, outside the hostess desk, I won't even talk about that. And then after I did the Masters in Public Health in New York, that was 67, 68, I worked with a really interesting little program called the Judson Mobile Health Unit. It was promoted by the Judson Church for runaway. This was the height of the drug scene in New York, and there were many, many kids who were runaways. And they discovered that they couldn't get medical care because most hospitals wouldn't treat them without parental consent. So the church established this unit, which was in a big trailer truck like they have at building sites. It had 3 rooms, so there's a waiting area, a sort of a lab, little mini lab, and then an office, a consulting office in the back. And I ran that unit for a couple of years. It was really quite a wonderful experience. And the kids were just allowed to drop in and drop out. We didn't check their names or their addresses, and we gave them whatever treatment was necessary at that time. And then after that, when I had one child in 70, and so I took a variety of part-time jobs during that time, and then the other child in 72, so I worked part-time at Planned Parenthood also, and for a while I worked in an abortion clinic, and I also worked at HIP, which was primary care, prepaid primary care, and that was in Brooklyn. I worked in a nursing home in Cobble Hill in Brooklyn. These were all part-time jobs. And an employee health service at Methodist Hospital, also in Brooklyn. And then I got into the drug field, I guess in the early 80s, and ultimately took on, as the children were getting older, I took on a full-time job with a methadone maintenance program down on East Broadway in Lower Manhattan. And that's where I spent the last 18 years of my professional life.
The next thing we're going to discuss is what would you say has been the biggest challenge in your chosen profession? And for me, that was towards the end of my profession when I was a nurse practitioner, and I was working in an outpatient heart failure clinic. And what I found was that a lot of what we did was dictated by administrative, non-medical people who didn't understand what you were doing and wanted to kind of churn people through as quickly as possible. And the type of patient I was taking care of were end-stage heart failure patients, very complicated patients. Some of them were being referred for transplant, for implantable hearts, heart failure pacemakers, I mean, really complicated patients. This was not a 15-minute visit. And when you didn't generate a 15-minute visit, they would come down on you and ask you why you weren't moving fast enough. And I found that very, very disturbing because that's not how nurses or doctors function. They function ideally with whatever the patient needs is what they get, and however much time it takes, that's how much time it takes. So we're not in the mindset of 15 minutes and I'm at the next visit. So I found that extremely challenging.
During the time that I was working in different places in hospital, AIDS became a big issue, especially in New York. people were very, very frightened. They were scared, and they had a very strong and ugly bias against gay people because they believed it was a plague that they had brought. So I really felt that there was so much more that we needed to do, that we had to do, that we could do, that we were not, because we were limited by bias and prejudice. The worst thing that I ever saw, really, was taking care of one of our own nurses who had pricked her finger taking blood from a young man with AIDS, and she ultimately died of AIDS. But nobody in the hospital hierarchy wanted to say that word. Like, oh, she has pneumonia, oh, she's not doing well. But we knew what was happening. And all the nurses in that little hospital in Homestead, Florida, would come in and comfort her and sit with her. But that was the best we could do.
My situation is completely different in the school system. And probably the worst thing that happened to me at that time, my husband was diagnosed with a glioblastoma, a brain tumor, and died shortly, and I had 6 children left to educate. So my school district was so wonderful, and I think they kept me busy so that I could read through this, and I had time to, to go and do things in school, and so I didn't have to be home all the time. So what they did was I became the coordinator for health education and health services, and I moved to the elementary school, and I was sent to Orange Ulster Bosse's, and we did a program which was new at the time. It was about child sex abuse, and we wrote the program. It was called GUS, Growing Up Safely. We called it GUS. And we started out, we went to the priest, the minister, and the rabbis in the town, the 2 towns of Milton and Marlborough, and they really supported us. And I had to teach all the classes in the elementary school. The teacher had to stay in the room with me, but I did the teaching. I had paper dolls for the little kids and show them the parts of the body, and nobody should be touching them and so on. The first week I had a little boy come and say, Mrs. Mandy, supposing it's your mommy that's touching your private parts. So this, of course, led into Child Protective Services, and this became a big thing in our district. I had teachers come up and cry in the hall because they had been abused by somebody before they got, nobody believed them, and they never even told their husbands. So it was a big thing. I mean, when I think of what's going on in the world today about everybody, involving other people in their sexual things, this was a big thing. I don't think it wasn't. And we sold this program. We went across the river, went to Beacon and Wappingers and Poughkeepsie, and sold the program. It was very, very successful. So it did work out, but I wasn't in a hospital, so it's a whole different ballgame.
Well, there's a lot of challenges, but 2 that come to mind. One, because I was a staff nurse and worked at the bedside for a long time, and then the second half of my career I was in administration. So anyway, I got to see the entire picture. One of the biggest problems that I found was staffing. You talk about staffing here, try staffing in the hospital. I was responsible for 321 patients and 1,000 employees. But when 1,000 of them called in sick and you had 321 patients that you had to care for, staffing became a real issue. Trying to make sure that all the patients were covered and they got some kind of a care. And the reason I bring that up is because you would get it from both sides. You would get it from the staff, how come I have to go over to this unit when I've been on this floor for the last 5 years, and then of course administration, well, you can't keep calling people in because that's financially, draining the system. I guess the other big problem, as a nurse practitioner, and even when I came here, I got a nurse practitioner position going out and visiting patients in their home for health and wellness visits. And one thing that used to no wonder I have high blood pressure. One of the things that really bothered me was the fact that, okay, so you assess a patient and you recognize that they have certain needs, okay? But you put those in the report and then you find out that they don't get those resources because why? Their health insurance doesn't cover it, or something like that. It's usually a financial situation, and that used to make me run home and take 2 blood pressure pills instead of 1. I mean, it was, because at some point we're gonna be in those situations ourselves. Where are the resources that we need? So that's always been, and even today, that's always a big problem,
I didn't really face any major challenges. I mean, I liked the work, and the last couple of years of my professional life, I was able to cut back my work to a 30-hour week. I was coming up to Newport's at that time, so I would take the first bus on Tuesday morning and go and work and sleep over in Brooklyn for 2 nights and come back on Thursday after work, and that was really a wonderful schedule, and I did that for 2 or 3 years. And then gradually, they started to computerize things at the clinic, and it became more and more complicated and less individual patient contact. And I wanted to take more time off for myself to travel, and that wasn't a possibility, so I basically just retired early. But it really, I liked where I was working. I had more trouble with administration than with the patients.
See, administration.
Yeah. The next question is going to be pretty easy for everybody to answer, and that is, what gives you the greatest joy in practicing your profession? And for me, there's so many stories I could think of to tell you, but I was preparing for this today and I thought of one particular story. And at the time, I was a nurse practitioner working down in radiology doing stress testing, nuclear stress testing and chemical stress tests. And when patients came in for the test, they were always very, very anxious because you're going to inject them with something and they were afraid and they didn't know what to expect. So I took a lot of time to explain it to them so they wouldn't be afraid during the test. And this one time, this very elderly, angry woman came into the stress lab, and she didn't want to really talk with us. And she was really, really angry, and it was very hard to communicate with her. And the nurse I was working with was an LPN, and she used to put the IV in and hook up the patient to the EKG machine that we would monitor during the test. And we were both kind of looking at each other thinking, oh, what are we going to do with her? We're trying to calm her down and she doesn't even want to listen to us or talk to us. She's just angry. And as you all know, I'm a dog lover. And on the bulletin board in the stress lab was a picture of my golden retriever. And I noticed while I was talking to her that she was looking at that picture. And I said to her, so do you have a dog? And that was the first time she looked at me. And she said, well, I used to have a dog. And then she started talking about her love of dogs. And I just kept listening to her and telling her what was going on. We got through the whole test. I don't think she even noticed that she had the test, because all she wanted to talk about was the dog that she had lost. And we bonded over that. And she was smiling. And when she left, she thanked me. And I remember the LPN, lovely gal that I worked with, looked over at me after the woman left and she goes, that was like magic. And I said, yeah, that was pretty cool, wasn't it? So, but I could think of so many stories. There were so many stories I could tell you.
Yes, I'm sure you can, Michelle. I will tell you one funny incident. I was working on the medical floor one late afternoon, and there was a big hullabaloo in one room. It was a county hospital, and the beds were about 8 beds in each room, so you can imagine how large the rooms were and how close together things were. And 3 young interns were standing around a bed where a very angry, disturbed, and belligerent old lady was lying and yelling at them. And they thought she was crazy. So they were thinking, well, we'll inject her with something. Well, let's tie her to the bed. And I passed the door and I heard what I heard. I said, oh, let me go in. And they said, what can you do? I said, well, I will talk to her. And they thought it was funny. I went in and spoke to her in Yiddish. She was speaking Yiddish. She did not understand a word they were saying, and how could they understand what she was saying? So I said, she's frightened and she thinks you're trying to kill her. So I solved the whole mystery, and it made me famous for about 2 hours.
Well, I had a little boy on the elementary level, and he was this cute little boy. He was very, very bright, and he had severe cerebral palsy. And I had to help him off the bus every morning, and I put him on the bus every afternoon. And this went on through the years that he spent in my building. We became very, very good friends. When he left, there's a statue out there in the lobby, and he had Mrs. Mandy on the phone with a stethoscope around my neck, and he gave it to me. Well, not too many years ago, I got a letter from him. They had done surgery, and he had this excellent job out in California, and he just remembered me and remembered the principal, and he sent us this letter, and that was very joyful to get.
Joyful. No. I think the biggest joy I got out of nursing was when I was in academia. And the joy of passing on my knowledge. Now, the students that I taught were already RNs. They were coming back for their bachelor's, so they already had a foundation of what nursing was about, but not all of it. But when you are standing, a lot of you are teachers, so you can recognize this. You're standing in front of the classroom, and you are providing them with information that is going to make, hopefully, give them more knowledge to be able to care for their patients, whatever that is. The joy was every once in a while, even if it was just one student, I would see the light bulb go on, and I knew I did my job, you know. So I think that was one of the biggest joys that I got, actually, was being a faculty person, and in the classroom and passing on. And the one thing they loved was when you could tell them your stories and apply it to the clinical setting. They were able to grasp that.
There were a couple of high points, I guess. The first one was in, I think, 65 in Atlanta, and I was called in to examine Dr. King. He had a bad cold. So I looked at his throat and I ordered some antibiotics, and he got better. And then another one was one of the units of the drug treatment program with which I worked, the Lower East Side Service Center, was a residential unit where the patients became drug-free. They withdrew from methadone and had intensive therapy and group work and everything. And there was an annual graduation, and that was really a wonderful scene when you saw these really, lucid, very well-spoken people having graduated from the program. They already had to have, I think, maintained a regular job for a year or two before they were officially graduated. And then that was a great joy to go to that graduation ceremony.
The next question I'm going to ask everybody is, what do you believe is the public's biggest misconception about your role? And I think I would have answered this differently before COVID than I'm going to answer it now. But I think the public really did not understand the level of experience and education that it takes to be a nurse, and how hard it really is to get that experience and expertise. And I don't think they really understand how technical the knowledge is that you need to be a good nurse. So I would say that's the biggest misconception. But we're going to talk a little bit about COVID and how that has changed after.
I agree with Michelle. If I had to go back to nursing now, I would be a total ignoramus. The young women now, they come in, before I've had a chance to see why they're there, they've already changed different lines, they've checked lights, they've checked people, they've looked into every aspect of the care of their patient, methodically and with great intelligence, and I stand there and I am awestruck.
Well, I guess as far as being a school nurse teacher, I would say they've done away with us because the teacher part is too expensive. So they have school nurses, they don't teach, they don't do the health, they have health teachers and they just have, the nurses are run the health office. But there's no teaching anymore because they become, I'm under the New York State Teachers Union and, you know, my pension comes from there. But we became too expensive in our field, so they've done away with us, and now the nurses are paid the same. Not that I'm knocking secretaries or anybody, but they're paid the same as the secretaries or the custodians in the schools. So I would find that would be the worst thing that I could say happened in my field.
I think that I have seen the change, I think, in the perception of what nurses are. Like, you know, Michelle said, we'll get to that in a couple of minutes, but a lot of comments I used to get was, well, nurses, they sit at the desk all the time and they drink coffee or they go on breaks, or this was especially true on the night shift because, you know, it's very quiet at night, and if you're having a discussion with another nurse at the desk, it kind of echoes around the hallway, and that they used to get the assumption that that's where the nurses were the whole time. Obviously not true, but, and then of course in the early days, when I first got out of training, you're talking about the 60s, the 70s, maybe the 80s, and there were a couple of programs on television that showed what the role of the nurse was like on television. So of course, when the nurse went in, they were expecting Lonnie Anderson. And I would walk in and they would go, yeah, I don't think so. So there was a lot of, you know, portrayal of nurses on television that was the furthest thing from the truth. There were a couple, maybe one or two programs. What was the one?
Call the Midwife is the most
Yeah,
accurate one.
that's a pretty good one. That's on currently.
Because that's how nurses really are.
I would like to go to those TV stations and kind of yank some of those old time shows that, you know, used to, I'm telling you, they used to think that my, you know, the uniform would be up in your, never mind.
I've been retired so long, I'm really not sure that I can even answer that question. The only other thing, maybe once or twice in my whole career I had a patient who did not want to see me as a woman doctor, but that was rare. I can't even think of specific instances, but it happened once or twice that they preferred to wait till the man doctor came in.
The real doctor came.
The real doctor came in.
So the second part of this question is going to be, do you think this changed after the COVID pandemic? How at least the role of nurses, I don't know that the role of physicians has, but I think the role of, the way people perceive what nurses do. And I think the only good thing to come out of COVID is that people now understand what nurses do in a way they never understood before, but in a way that we all understood who are in the profession.
That is really very true. I don't know why nurses used to be put in such a secondary position. Maybe because the doctors were all men, but let's not go into that. But as COVID became so horrifying and demanding, and the doctors worked very, very hard, but who was running in and out and doing everything around the doctors? The nurses.
I would have to agree with what you just said, but I think that the role has changed where the nurses were there. I'm not knocking the doctors, but the nurses have certainly been there hours and hours and hours, and they're the ones that are taking care of the dying people, and I think that people are looking at them with what they really do today.
That is all true. But even from the beginning, why do patients go into the hospital? You have to just think about that. Why do patients go into the hospital? They go into the hospital, right, they need care, but who's the one who's giving the care? Is the nurse from the physician's orders. The physician is not there 24 hours a day. He has the nurses really be their eyes and ears and everything else. The nurse is the one who always, from the very beginning of time, reported back to the doctor with any changes, whether it was a change in their condition, something about the medication that needed changing, anything like that. It was always the eyes and ears and nose of the nurse that was there 24 hours a day. But that became so much more evident with COVID, and I think people have a better appreciation now when they go into the hospital of what the role of the nurse really is.
No, I think that's all true. I have nothing to add.
All right, so the next question I'd like to ask everybody, and I always tell my students to think about this as they go on in their profession, and they're always kind of dumbstruck and they don't know what to think. But I hope that when they're ready to leave the profession, they can answer this question. And my question is, what would you like your legacy as a health professional to be? And I've thought about this a lot the last couple of years of my career. And for me, my legacy is the Heart Failure Clinic, but my legacy is also anybody I've mentored or I've taught. And I used to tell that to the students, you're my legacy because you're gonna go on after I'm gone, and what you do at the bedside, I hope that I've influenced in some way.
I really don't know if I have a legacy as a nurse. I would hope I would have a legacy as a good human being.
I would hope that too, and I would think in a way as an educator, because I was in that field also.
Well, you already know how I feel about education. And the same thing, that I would hope that I was able to pass on some information that the students could utilize and remember. I have a lot of my students that went on to get masters and doctorates because of, being in the classroom with me. So that always made me feel good. So that's one of the things. And of course, I think the other thing would be basically what you were talking about, being a caring person and a dog lover.
I haven't left much behind, but I think in the future, there are organizations now that are struggling and striving to promote universal health care in this country, universal Medicare, something like that. And there are physician organizations that are fighting for that, and there will be an increasing movement, I think, for that in the future. So I think we still have a lot of work to do to, change the ridiculous non-system that we have in this country.
I think the last question I'm gonna ask is, and this was, I think, Joan, I think this was your question that you wanted to add, and that was the changing role of the nurse from the 60s to now. So I think it's changed dramatically. I got into the profession in 1978, and the amount of knowledge and technical skill that you need has grown exponentially, I think.
I would agree, but even though I retired after 30 years, I started early in the 60s. Whenever somebody in the neighborhood said, uh-oh, go see Frida, she'll take care of it. And by that time, my skills were very, very much diminished. But I would put on a brave face and say, that looks interesting, go see your doctor.
the sixties, I was still working in the hospital, so, I think everything has changed since. In education, in business, nurses that are involved with IBM and places like that, I think our whole thing has changed. So, especially since COVID, I mean, really, come on. Or look at the the nurses are amazing, the ones that have worked through this hospital situation with COVID. I mean, I remember working from 7 at night till 7 in the morning, and they have done it for 2 weeks at a time. They don't even get a day off. Unbelievable, really, they're remarkable.
Yeah, changes. I remember when I first started out, I worked in coronary care unit. And in those days, we had two drugs for heart patients. the Judson and Lasix, a water pill. That was it. Now there's a book that's about that thick, that's all full of cardiac meds. And the reason I know that is because I used to teach advanced pharmacology to the master's students in the nurse practitioner program. And to try, one thing I couldn't get across to them was how you had to memorize the book. But if they knew where to go for the guidelines and that kind of thing, so it has grown. That's just one example of what has grown in nursing over the last however many years we've been in it. And you multiply that by every single system of the body, I mean, you know, it's really amazing what we do now.
I've been retired so long that there's nothing personal I can say, but my comment is that it's really unfortunate that we now have these huge partnerships of 50 doctors in a group, and you never see the same doctor again, and we are losing the family practice, and I think that's a big, big problem.
I think we're also losing the art of the physical assessment, the physical exam.
Wasn't in the ancient days, physicians were, in the old days, weren't physicians actually an art being a doctor in the ancient Greek days?
It's still an art, but they don't have time to do the physical assessment that they did before, and that's a big loss. So we're going to end our question and answer discussion here, but if any of you have a question that's dying to be asked, please stand up.
I don't know if I need that, June.
Yes, you do. It's being recorded.
I just want to, if you would explain to me, registered nurse, nurse practitioner, PA, is the difference education?
Yes.
Yes. Yes, the level of education and training, and the responsibilities too.
Mm-hmm.
So a nurse practitioner can diagnose and treat, write prescriptions. So a PA, I don't know what it is now. I know what it was. Yeah, they're under a physician's practice usually.
The doctor has to sign
Yeah,
off.
so they have to sign off. We used to have to be under the supervision of a doctor, but that's gone. We don't have that anymore. So yeah, it's the level of responsibility and the level of education.
Thank you.
Betsy's next.
Joan, I wondered, when you left your classroom, you're teaching health, you're called to the nurses' room. Who covered your classroom? I just imagine chaos breaking loose.
Sometimes, they would find somebody that would come, but it would have to be something serious downstairs in order for them to send help up. That was always a problem in the high school. Now the elementary school was completely different, and I had a nurse practitioner, or another nurse teacher. She was retired, but she used to come and cover me while I taught on the elementary level, but not at the high school. It was a definite problem. So.
Yeah, a few of you mentioned that you had situations where you took patients without insurance, without asking names, and so on and so forth. In the current situation, I mean, from the point of view of liability, of the point of view of safety, I mean, of not knowing what a particular individual has undergone or what he has been doing before he came to see you and so on. And the other thing is from the administrative point of view, how can this Can you see situations like that being reproduced today with all the healthcare being basically an industry? It's like so not only regulated but also financially, oppressive. You mentioned the pressures from administration about how much time you spend with the patient, and that seems to be getting worse, not getting better.
I agree, but I've never been able to see a patient without them checking all those things and that they had insurance. Although we did have a free cardiology clinic on Wednesdays that the cardiac fellows would do, and if they didn't have insurance, it was a way for them to get experience. They were all internists, so they were getting certainly an experienced physician, but not an experienced cardiologist. So I've been in those situations. Anybody want to add to that?
Thank you all. It was really wonderful to hear about your professions, and I know just the last 2 years with the COVID, every time I would read the newspaper, I would just say, thank you, nurses and doctors. Thank you so much. But anyway, for those of you who were here last week and heard the mental health practitioners and had some concerns here in Woodland Pond about that, we're really happy to mention that there is a mental health survey that management has approved. It's in your cubbies. Please fill it out. No matter where you are on the topic, just fill it out, please. Thank you. And return it. Thank you, Betsy.
Okay, we're going to end it now. Thank you all for coming. I hope we have given you some information about this.
Yes, I'll be very nurse-like.
Thank you.
No, I don't. You have GPS? Yes. I gotta get you this. Your neighbors. Or near that galaxy.